One more time, good afternoon, and let us understand what all needs to be documented. So, I just want to bring this to your notice. There is a very good book written by Dr. Atul Gawande. The title is The Checklist Manifesto. He has moved around a lot of industry and found that everybody follows some kind of a checklist to make sure things don't go wrong. So this needs to be done in our activity also, and there's a surgical safety checklist given by WHO. And if any of you is not practicing timeout procedure, I would strongly urge all of you to practice timeout procedure. Sign in and sign out are also important activities. Pre-operative checklist needs to be filled up just before the patient is entering the theater. Uh, that has to be signed by the theater nurse, the OT nurse who gives block, and needs to ensure that everything has been done as per the protocol or as per the suggestions of the doctor. There's a logbook of autoclave cycles that need to be maintained. It's called mechanical monitoring of autoclaving, and what time the heater was turned on, what time we reached the required temperature and pressure, and what was the holding time. All that needs to be recorded, because as Dr. Chandrasekhar said, class 1 indicator only indicates that the temperature was achieved. So here at least the logbook will tell us that the cycle was run properly. This is the autoclave strips registers that we maintain. Three things here: the strip color must be jet black, because it indicates only the color change, the temperature has been reached. So if the color is not jet black, believe that the temperature was not achieved. This needs to be signed by the theater in charge and by the surgeon both, and both of them are certifying that the color of the indicator strip was jet black. Similar register can be maintained for fast autoclave, the flash one, for ethylene oxide gas sterilizers also. Then we are using biological indicators which need to be used every week. That needs to be sent to the laboratory, and at the end of 72 hours, if no growth is seen, then we can certify that the sterilization had actually occurred. So this also needs to be reported, and a register need to be maintained. Cultures taken from sterile and unsterile items, report of this culture is also, I mean, this is about air sampling. The air sampling can be done using open dish sedimentation technique or by using air sampler, and culture sourced from sterile and unsterile items report need to be maintained. Not just that, how to interpret the report is also very important. So the growth of gram negative organisms or fungus cannot be tolerated at all. Gram positive organisms, a few colonies from unsterile area is okay. So sometimes I have seen people reject everything if there is a culture report comes positive with a few colonies from unsterile areas. We have not sterilized the unsterile areas, say for example the OT table or the wall or floor. There can be some growth. So how to interpret the report is also very important here. We need to maintain record of whatever material consumable that we use. As Dr. Chandrasekhar sir mentioned, the consumables were reused without re-sterilization, ended up with cluster infection. So the batch number and the expiry date need to be mentioned in the register. Similarly, there are several tasks being performed inside the theater. Somebody does the job of fumigation, somebody does cleaning, somebody does cleaning of the overhead tanks. All that need to be recorded, and only then we'll be able to fall back upon these details to cross check in case of a problem. Then there are several checklists that we fill up. There is one daily cleaning checklist, there is a weekly cleaning checklist, there is something monthly, and also a quarterly. All these reports, and Dr. Gawande also very clearly said that keep the details on the each checklist minimum, and most likely the answer should be yes or no, so that the people who are filling up don't have to spend so much time and they really do it well. So all these need to be maintained. Only then we can retrospectively find the root cause. unless we have the line listing of who was the surgeon, who was the assistant, who was circulating staff, which operation theatre was used, under which microscope this surgery was done, etc., and the chronology of the surgical order. Only then we can find out if the second and third cases were infected, or all the infected cases were operated by the same surgeon, etc. If we have not documented these details, there is no way we can find out anything. Similarly, if you have maintained details of the batch number and expiry date of the irrigating fluid and other consumables, we can really understand if anything has gone wrong as far as these consumables are concerned. Autoclave SIFS register will tell us whether the job of sterilization inside the hospital was done properly or not. All the activities register will tell us whether this particular activity was done or not, who did it, when that person did it. So unless these are there, we cannot investigate root cause, and whenever we try to investigate where we did not find this information, we could not go into further details. But as Dr. Chandrasekhar also mentioned, if these details are maintained, we can exactly pinpoint the root cause, and at the end of everything, if there are legal issues coming up, then this documentation will be the only savior. So at the end of the talk, I would like to say that documentation cannot be overemphasized. It is mandatory requirement, and we all must do it. Thank